Hi, welcome back to Nursing with Bonomi. Today, we're going to talk about giving report.
So for this first example, we are going to demonstrate how a hospital nurse, this guy, gives report to a nursing home nurse, this girl, for a patient that we're about to get admitted.
Okay.
This patient is going to be a post-surgical patient that I'm going to be receiving from the hospital.
Okay. Ring ring.
This is Naomi at the nursing home. How can I help you?
Hi, my name is Benjamin. I'm an RN from the hospital. I was hoping to give report on Steve Smith.
Okay, 1 second. Let me grab my papers. Okay, go ahead.
Okay. So Steve Smith is new to your facility. He's going there for rehab.
Okay.
Steve Smith, he's a 67-year-old gentleman who fell and broke his right hip.
Okay.
So he is post-op day 4
Okay.
of a ORIF of the right hip.
Okay.
He has a dressing that's dry and intact. There's surgical staples at the
Okay.
site. So he has a silver Mepilex dressing that is dry and intact. No breakthrough drainage has been noted.
Okay.
Um,
Is it to be removed on a certain date?
Post-op day 7.
Hold on 1 second. You have a booger out of your right nose. Yeah, and I don't know if it's going to be visible or not. There you go. Okay, now it's on the outside of your nose. There you go. Okay, now just go to your pants. Okay. I think we stopped at post-op day 7.
Post-op day 7?
But before you said post-op day 4.
No, he is post-op day 4, but the dressing's to be removed at post-op day 7.
Okay, let's back up for a hot second. Does the dressing need to be removed on a certain date or anything?
Dressing is to be removed post-op day 7.
Okay.
So the patient is alert and oriented times 2.
Okay.
He is a little bit forgetful at times, a little confused. He fell because he was chasing after something at home and he tripped. He thought that he saw something at home and he was a little confused and he fell.
Okay. Does he have a catheter?
Yes. He does have a chronic Foley.
Okay.
It was last changed by us in the operating room.
Okay. Does he use oxygen?
Yes. He is on 2 liters of oxygen at nighttime.
Only at nighttime?
Only at nighttime.
Okay. When was his last bowel movement?
Let me check. Just a second. Looks like his last bowel movement was today.
Okay.
Yeah, surgeon was happy, with his, bowel function returning, so that's why they said he could go today.
Okay. How's his ambulation?
So he is a assist with the walker.
Okay.
He's a ×1 assist up to the chair.
Okay.
And he does need supervision because he gets a little confused at times.
Okay. Is he continent?
Of bowel. Let me take a look. Yes, it looks like he is continent of bowel.
All right. What's his diet like?
He is a diabetic. So we've been doing finger sticks, AC and HS. He's on a regular diet, regular texture diabetic diet.
Okay. Carb control. Okay. How has he been eating?
Appetite's been fair. It looks like about 50% of his meals or so, 50 to 75% of his meals.
Okay. What was his last vitals?
Blood pressure was 142 over 86.
Okay.
O2 was 98% on room air.
Okay.
Pulse was 93.
Mm-hmm.
Temperature was 97.4.
Okay. And his last blood sugar?
Last blood sugar looks like it was 175.
Okay, is he on any narcotics, pain pills, anything like that?
Yes, he has required. He did require some. He was on a PCA initially after surgery, but that was discontinued, and he is now on oral Percocet.
Okay, when was the last one given?
Last one was given 6 hours ago, but I'll make sure he gets a dose before we send him.
Great, thank you. And you'll be sending a prescription as well, right?
Yes. I'll go ahead and take care of that. I'll make sure the doctor gets a prescription.
Yeah, please, because if we don't have the prescription, we can't give it to him.
Okay.
Also, what was the name of the surgeon?
It was Dr. Greg.
Okay.
Dr. Greg Smith.
Okay. And does he have a follow-up appointment set up?
Let me take a look at the doctor's instructions. Looks like he wants him to follow up in 1 week.
Okay.
In the clinic. No, I'm sorry. I got confused. It looks like 2 weeks for staple removal.
Okay. And what was your name?
My name is Benjamin.
Okay. And what number can I reach you at?
You can reach me at 555-1234.
Great. Okay. Thanks so much.
All right. Thank you.
What time is he going to be arriving here? Sorry, or transporting from you guys?
Oh yeah, social work set up for transport at 4 p.m.
Awesome. All right. Thanks so much. Have a great night.
All right. You too.
Bye.
Bye.
Wah! Yeah, so it's a really big deal that they give a pain pill before they transport to the facility, and it's a really big deal that they give a signed hard script with the patient, because otherwise it is going to take hours to get them pain medication, especially if it's at night. Forget about it. That happens, and you will just have a very angry patient.
Yeah, and
So it's extremely important.
yes, yeah, it's a pretty big deal. So, working in the hospital side of things, this isn't something I had to do a lot, but it is, something I did sometimes. Sometimes patients, I worked mostly night shift, and sometimes patients would discharge on night shift, and sometimes they discharge at all hours of the night, which is, kind of unfortunate for them, because it messes them up, but
Messes us up too.
yeah, so
Because we're in the middle of our med pass with like 2 nurses. But anyways, it's really important to find out the surgeon's name, because every once in a blue moon it can be hard to find it, like in the paperwork for some reason. And if there's an issue, you have to know what surgeon to go to and what surgeon their appointment needs to be with. So it's a good idea to ask them that right then and there, just to make sure. It's just easier. You don't have to dig through all the paperwork, and you can get their follow-up appointment scheduled quicker that way.
Yeah, and as a hospital nurse, make sure you have kind of a template of what, just a kind of a rundown of your report. You can probably basically read your report notes. A lot of that will suffice. Your shift to shift, report that you got from the previous shift should have a lot of the information that the nursing facility is going to need. But make sure you have your computer open, you have your, Epic or, Cerner or whatever system you use. Make sure you have that pulled up in front of you, for those, questions that you may not be prepared for. But, those are all very fair questions. It wasn't an interrogation or anything. So, those are all things professional to professional that, you should, be able to tell the nurse.
Let us know what you thought of this video in the comments below, and we'll see you next time where we put the page into practice.